Good afternoon, everyone, and welcome to Windows on Wellness. I'm Shehnaaz, and I'm delighted today to be joined by Dr. Ashish Paul. Her credentials are too many to list, but I will say that she's been practicing Ayurvedic medicine and herbal medicine for decades now. She has a clinic on Harley Street, and she's also very grounded within many communities. And we all often look to her for lots of different tips and advice around women's health. How are you today, Ashish?
I'm very well, thank you, Shehnaaz. And I'm very excited to be starting this and to be putting all of this educational stuff out there for women, for younger girls, and for families.
Absolutely. And I think the topic of women's health, and you mentioned it's not just about women, it is about families. And it is about younger women, young girls to really think about and own their mental health, their physical health. But I know that often we shy away from these topics, and particularly in some of our communities, you know, we don't want to speak about certain things. There's taboos there. Why is that, do you think?
Around everything around women is the fact that everything excites men. Our boobs excite men, the bums excite men, the bodies excite men, the hair excite men. So everything related with women is actually taboo. If you think about anything, you know, you can't put, I've got dark lipstick on. I know that is a taboo that you are inviting for it. You've got lips very red. So I think it's just women just have to get out of this whole situation, you know, because it is costing them and it is costing us our health. Because the reason that there is so much breast cancer is in Asian community because nobody wants to talk about breast. Yeah. And that's why they don't go to doctor, because it is not nice to have it being prodded by a doctor, especially if it's a male doctor, they would even hesitate further. So it's a general issue. We know that women's issues are not highlighted in our communities, which is, you know, it's a downfall from there. We don't talk about periods, we don't talk about fertility, we don't talk about what happens after you have the baby, then we don't talk about the menopause, we don't talk about any of this. And whatever we see that we are talking about, it's very much superficial. It's so much still on top. So it is to do with overall how we see women in the society. So that is the reason that we don't talk about it.
Yes, absolutely. So one of the things we want to do is to talk about it. And what I love about speaking about these things with you is that you bring the humor and you're just straight up. You know, we're not going to beat around the bush. We're not going to, you know, kind of just take soft steps around and be superficial. We're going to really go deep. So we've got a number of topics that we're going to be covering during the course of 2022. And what we wanted to do today was to just give our viewers a little sense of each of the topics that we'll be covering in a hope that people will join us. And we'd like to do some live sessions where people can actually broach the subject, educate themselves. There's no shame in not knowing all of this, especially if you grew up like many of us did, not knowing. So we'll definitely help to inform and educate people and then offer them the opportunity to speak and ask questions. So if you were to give me some of the key things that women struggle with right from the time that they are young, maybe even 9, 10-year-olds. I have a 9-year-old myself. That's kind of why I'm asking. All the way through the teens, through adolescence, and then through their you know, 20s, 30s, 40s and beyond. What are some of the key themes that you see repeatedly that women need to speak about more?
Oh, wow. You've given me a huge range of the whole, what we call fertile years for women, you know, because fertile years start from when girls start to have periods up to the menopause and even a few years after. So that is the whole range of, they are called reproductive years because you have the capacity to reproduce from the moment you start having periods. I feel the first thing, you know, you have a girl and I have a girl too, and a boy as well. And I think the first thing for us is to let them ask a question. and not discourage them from asking a question. Like my son would ask me a question about condoms and, penis, or my daughter would ask me a question. If we as a parent don't shy away from giving them a medical information, whatever we know. I mean, I'm trained medically, so I can give medical information. For those who are not trained medically, you can tell them without bringing your own judgment to that topic, because it is so crucial. I feel that when the moment parent shies away from talking about it, it puts that onus on that child, and they learn that shame around that subject. Because if child is only going to ask you once, and the moment you shy away, they're not going to ask you second time, because they know that you're uncomfortable, or maybe you don't have the answers. And they're going to think, okay, next time I'll ask somebody else, or I'll find from the wrong sources. So I think that's very crucial for us to ask the questions. And same goes, I think, at every step, whether it is then to do with our fertile years, to do with our periods, to ask those questions when we don't ask our parents. Initially, after 18, when we go and ask doctors, at least go and ask them, because then we get into that habit of just not asking. We also think, and women also think, okay, it is only a period. It is only a difficult period. It is only a painful period. It is only, okay, I didn't conceive for 2-3 years, I will conceive. So we don't ask questions because we are discouraged many of the times in the very early years. That's my personal experience as well, because I don't see any information of mine that came from my parent. None.
Yeah. And I know also many of my friends, for whom the subject was definitely closed. And even when they would have started their periods, then it's kind of go and find out from somebody else, or maybe it's an older sister perhaps who's gone through it, but you certainly wouldn't ask your parents, or you'd be getting information from magazines and so on and so forth. And now, of course, with the internet, we can find out all sorts of things which could be completely misleading. They might also be helpful, we don't know. So I really like that, to open up the space to ask questions. And if, like me, so I have both my girls, 9 and 14, there will be things that I thought I knew that now I don't know that I know, or I don't know things in the same way, in the same depth. So, for example, is it one of the classic questions that comes up is that, is everybody's period the same length of time, and should it hurt, should it not hurt? Give me a simple response to that, for example.
It's only 25% of the women have the period of 28 days in the world. So it's a misnomer. It's such a myth. And also only between 25-30% that women ovulate on the 14th day. It's not. Everybody's cycle is different. So medically, we have a range of periods starting from 21 days to 35 days.
Right.
So that is a range of 3 weeks to 5 weeks. Yes. And if you have a range of 3 weeks, you're going to ovulate almost straight after you finish your periods. If you have a range of 5 weeks, you will ovulate after 15 days or so, or much more. So your ovulation might be 16, 17. And I see this being missed in almost all my fertility patients, where they had no information about their ovulation. And ovulation, again, it does not happen right in the middle. It's not that nobody has bang on periods. Who has bang on periods? It's and plus, if you have slight tendency, whether it's endometriosis or polycystic ovarian syndrome, which is becoming more and more common, then periods differ so much. And your fertile window is only unique to you.
Yes.
So it's a misnomer. So it's not correct.
It's not correct. So you have to understand that there is a range, and that we're all part of that range. And then you talked about where we might have things like endometriosis or PCOS and so on. And again, I don't know if this is a myth or a reality, but I definitely know of friends who were given the diagnosis that says they have one of those two things, therefore you're just not going to get pregnant. Is that true?
Not true. It's not true. What is true is that in the arena of infertility, as we call it, or subfertility, These conditions reduce your fertility, may reduce your fertility. We see the highest number of patients in infertility clinics who have endometriosis and PCOS, but not everybody who has endometriosis and PCOS, they are not infertile, or they may not even realize, and they are pregnant, and afterwards they realize that they have endometriosis or PCOS, because that is very common as well. Yeah. So it's not correct.
Wow. So I think one of the things, well, a couple of the things that when we ran a poll recently, we were asking our audience, what kinds of things would you like to discuss? And these were some of the topics that came up. So what about my cycle? What do I need to know? Well, first of all, you need to know it's your cycle, right? But also there's a variety of things. So these are the things to look out for. And if you have a medical condition, then it is definitely a myth that means, you know, that conception is not possible, because you've definitely worked with people for whom it has become possible. I want to just take a little sidestep to say also that the reproductive system is only one system in the body. So what about the other systems in the body, and how does that kind of symphony, if you like, work within our bodies?
So we have also, women also have to look after their breasts. So that's also, it becomes a gland when we are breastfeeding. Most of the other times, or if you don't want to have children, then it is kind of a redundant organ for most women. But that is something that we need to look after as well. Also, when women have heavier breasts, that needs to be looked after much more, because cysts and fibroids, and not fibroids, the fibromas of the breast or the cancers of the breast can hide in bigger breast, because you are not able to palpate it very well as compared to if you have smaller breasts. So that is that we need to look after. And you rightly said, yes, we have all the other organs in the body as well, not just reproductive organs. And what I think what women miss about reproductive organs is that your uterus and your ovaries are glands as well. They are glands which secrete hormones. So you don't just need them for producing a child, you need them before and after. They produce estrogen, progesterone, these hormones, which are linked with our mental health. They are linked with our bone health. So we need them before and after, because I know that on the poll, many women had ticked that they have heavy periods, and heavy periods many a times lead to hysterectomies at a very younger age. Women who have had kids, even at 40, 45, doctors advise hysterectomy, which is taking the whole uterus out. Quite commonly, that, oh, why do you need the uterus now? But the fact that it's a gland, it's still producing hormones, and the impact of that in later years, and you need these glands much more in later years, because you need your bone health, you need your mental health, you need your skin health, also you need your sexual health. So it's all interlinked.
Absolutely. And this idea that we can somehow compartmentalize everything is just crazy, right? You need to understand the synergy, take a holistic approach. And even also, if we may just for a moment touch on the gut, because we talk a lot now these days about gut-brain connection. How does that play into women's health?
Not just gut-brain connection is only being explored now. In Ayurveda, we say everything starts from the gut. Every natural medicine says that every single disease starts from the gut, because we are what we eat and digest and assimilate. Also, with the gut infections, the infection travels to reproductive organs much faster. So women who have IBS kind of gut, or Crohn's gut, or a leaky gut, they will have more conditions such as endometriosis, and the infection of the uterus and the infection of the tubes, or the PID, what we call pelvic inflammatory disease, is much more common in where their gut is compromised. So, it's interlinked. That is the beauty and the complexity of our human body, is that how it is interlinked. And we don't realize how gut can be then linked to reproductive organs.
Yes, absolutely. And one of the things that we're doing, with our younger people is we're talking about diet, we're talking about mental health and well-being, And for them to link that then to the reproductive system, to the fertile years, all of these connections need to be made. And so I really want to make sure that people understand that we're welcoming young women and young boys to understand and explore with us safely with Dr. Ashish, who has medical training and who really is trying to make sure that we are well informed, so that when we make those decisions, we are drawing from the best information that we can. And of course, you have to go with what your own system does and so on and so forth. But for many of us, there are myths to bust. There are things we just don't even know how to connect. And I really know that your big, if you were to call it a mission, is to make sure that people understand and then get the right support. Yeah.
Well, you work with oils, and I also work with oils, essential oils. I love them. And its mission is to tell people that invest a little bit more into your health. We only have one body. We cannot exchange it for anything else. We only have one mind. We can, you love it or hate it, like Marmite, you have to live with this, what you are given. So it's better to then live with it and to learn how to make the best use of our resources, what we are given. So it is, if you have dry skin, you learn to put more moisturizer on, you learn to put the best quality moisturizer on. Do you know that women end up having more infections because they use more makeup? Makeup is one of the most commercialized and full of chemical stuff. And obviously women are using more, men are also using makeup. I'm not against men using makeup. But knowing these little things, how we can make these changes, and all these chemicals, especially for girls and for boys as well, they are hormone disruptors.
Absolutely.
So everything that we're using in the house, everything that we put on our body. So it's true that anything that you cannot eat, you must not put on your body. Because it is eventually going inside you through your skin, and skin is the largest organ. So imagine if you're taller, you have more of that surface area. So your mission and my mission is to educate yourself. I'm not against modern medicine or any medicine for that sake. But we are moving more towards chronic health conditions. We are not in, when we were hunter-gatherers and all those hundreds, thousands of years ago, it was more acute stuff we used to get. Now we are more in chronic issues. We don't have those kind of infections anymore, but we have long-term issues, which will start for some people at 40. And then by the time you're 80, you're living with something for 40 years, something like diabetes and heart conditions and hormonal issues, menopause, for example. If you had menopause at 40 and you're living up to 80, it's 40 years, you'll have to deal with that. Right?
Absolutely.
So that is where my mission is.
Absolutely. No, thank you so much. And on that, we are aligned, because we want to have the best quality of life that we can, which means making the best decisions we can. We won't get everything spot on, but the more we keep learning and understanding and making small changes that make a big difference, then the better it will be. So I really hope that everybody watching will get a sense of what we're going to be doing. We're going to be asking questions. We're going to be holding space for each other. We're going to ask Dr. Ashish to give us as much as she can from all her years of practice. And together, we really do hope that you can make the right choices for you. And let's just open the Pandora's box and talk about the things that we should have been talking about all this time. So thank you so much. We will share with everybody the dates and the topics that we will cover, and this program will begin in January 2022.
Thank you, Shehnaaz.
Take care. Bye for now.
Bye.